I'm a specialty doctor in anesthetics and intensive care. Today, we're starting this plenary session. We're going to introduce the topic of incivility. There's going to be three different people who are going to be presenting their data on this. We're going to wait a few minutes. We're just going to give it 2 more minutes to see if a few more people are going to join. And then we're going to start with our presentation. So it's 3 minutes past 2 now, so I think it's a good time to start since there's going to be a few presentations. I hope you can all hear me well. All right, okay. So we're doing this presentation. It's primarily from the anesthetic department, and it's basically on incivility within the workplace. So to give you an introduction, me and Dr. Diwan, we basically decided to do this quality improvement project within the anesthetic department, and we sent out a survey. It was basically via SurveyMonkey to our colleagues within the anesthetic department, and we got a few responses. And based on that, we have now compiled some data on the incidence of incivility and how people are dealing with it within our anesthetic department. So I will start by explaining what incivility is. So to define it, it's basically low intensity negative interactions with ambiguous or unclear intent to harm. Some examples of that are insulting comments, not giving someone their due credit, spreading false rumors about someone, social isolation. It's quite a subtle way of doing it, but it is indeed incivility, and just bad manners in general. So bullying, it's kind of an acute version of incivility. It kind of, you can merge them in the same category. So to define bullying, it's basically any interpersonal behavior by a staff member that acutely or frequently undermines, humiliates, intimidates, or drives distress or harm to other staff in the healthcare workplace. Now, some of the data that will be presented later after my slideshow will also include things like harassment, violence, sexual harassment. So we will start with incivility, but some of that will also be included later. So to quote this very important study that was done initially in 2009, it's titled How Rudeness Takes Its Toll. So what happens when someone is rude? And this is extremely relevant within our workplace when you're working in healthcare, and even more relevant in theater settings or acute settings like A&E, obstetrics. So when someone is rude to a colleague, there is 61% reduction in the recipient's cognitive ability. Now, this is quite significant. And if you put this number into healthcare setting, it can really poorly affect how we treat our patients, and it can lead to adverse events. Now, what happens to bystanders? Now, when incivility happens, the colleagues are 50% more likely to miss a calculation error and reduce their willingness to help. If we put this number into anesthetic, into what's going on in an operation theater, and if it increases the risk of calculation error by 50%, that is a very dangerous number. So the price of incivility, this is, I'm just quoting another study that was done in 2013 by a few of the same authors from the last study, and this was cited by the UKPHR. So basically what the data they found was that what happens when someone is rude? What happens first to the recipient? So 80% of the recipients, they lose their time worrying about the rudeness or about the incivil incident. So that does take away their mind away from what they're actually doing at the time. There's 38% reduction in the quality of their work. There's 48% reduction in the time at work. So it may or may not reflect sickness data or the percentage of absence or sickness within the different departments, which is high in the acute settings like A&E, operation theaters. And it may reflect that maybe physical health is correlated to the mental well-being, which indirectly suffers from incivil incidents. Now, 25% of the recipients of incivility, they take it out on the service users, which in our case would be the patients and their relatives. Now, let's look at what happens to the bystanders. So there's a 20% decrease in the performance of the bystander, and there's a 50% decrease in the willingness to help others. What happens to service users, the patients in our setting? That leads to 75% less enthusiasm for the organization. So that can reflect the patient feedback for different trusts within the NHS. So basically, incivility, it affects everyone from just one incident. The recipient, the bystander, and the service user, they're all affected by it. Now let's look at the actual cost in terms of money. How does it affect the NHS? So this was a 2018 study done, and it basically said roughly 2.3 billion pounds are lost in a year because of incidents of incivility, harassment, bullying, and that's a huge number. The King's Fund in 2019, within their health and care workforce report, they basically said that staff are leaving the NHS because of these incidents, because it impacts their job satisfaction and morale. And it very easily reflects the difficulty in staff retention within the different NHS staff trusts. So we're going to look at one of the NHS staff surveys. There's a few numbers here, but roughly more than 0.5% of the responders in this 2022 NHS staff survey basically said they experienced harassment, bullying, or abuse within the last 1 year. Out of that, 27.8% was directed from the patients, their relatives, or the public, 11.1% from the managers, and 18.7% of colleagues. Now, if we break that down in ethnicity, 25.5% of the ethnic minority staff members said they experienced these incidents primarily from managers or colleagues. 21% of the white native staff reported similarly, and interestingly, 16.4% of the disabled staff, including physical or other disabilities which cannot be seen, they reported similar numbers. Now, to quote another study, this was done in 2018. Basically, it gives us some very interesting data and numbers. So basically, this was a literature review of roughly 13 studies. This was a UK study. This was published in 2022. And they basically said that within the responders, 77% of the physicians said they had faced such incidents. 65% of the nurses responded similarly. And basically, they came out with the data that 97% of responders said that they do experience stress after these incidents. It led to 53% compromise or reduction in the patient safety. There was compromised quality of care in 72% of the cases. It led to errors in 70% of the cases. This is quite significant, and this shows us how important it is for us to deal with this situation, or to cover incivility and look for solutions for this. Now, very interesting, and I think it is very realistic that the junior staff are affected twice as often as consultants. So your job role or your position within the hierarchy does affect how you are affected in with regards to incivility. Now, very relevant to theaters, and everyone will have maybe a slightly biased view with regards to this. So, disruptive surgeon behavior, it did increase anxiety in the perioperative teams, like with all members, with the scrub side, the anesthetic side. Um, Coming to adverse events, there was 67% rise in adverse events, 71% rise in medical errors. And if you put that into anesthetic, that leads to high risk situations that can lead to morbidity or mortality. And if you're looking at numbers for mortality, that there's a 27% risk of mortality due to incivility. Going on to the next slide. So I'm going to now tell you the findings that we had from our survey. So basically, it's titled Incivility at Work, the Incidents and Effects, and it was done by me and by Dr. Diwan, my consultant. It was done within the anesthetic department. The first question was, what is your job role? We had 25 respondents, 56% were consultants, and 44% were the resident doctors. We asked people how frequently they had experienced incivility within the last 2 years. Now, half of the respondents said they had experienced it 1 or 2 times within the last year. And roughly 1/5 said they experienced it monthly, and another 1/5 said they experienced it quarterly. So that is quite a significant number. Coming on to the next question, we asked them how they normally respond when encountering incivility that is directed towards them. So this is the question from the recipient of the incivility. And roughly, it's quite interesting that roughly one third of the people said they confront the person, but 1/3 said they ignore it. Another few people, 21% said they basically speak to someone in management and ask them how to deal with the situation, or they basically ask them to deal with the situation. And one interesting response was the person, they don't confront or ignore it. They basically look at the situation, they look at how it affects the staff members and the patient, and they try to use the 4D technique to try and manage it. Now, I will give just a brief idea of what the 4D is. It's a bystander intervention technique, and Dr. Walker will later elaborate on it. So the 4D is basically, 4D stand for direct, distract, delegate, and delay. Based upon what the situation is, who the person being incivil is within the hierarchy, and what their nature is, you confront them. So direct, distract, delegate, or delay based upon that particular situation. So the next question was, how do you normally respond when encountering incivility directed towards another person? So this is basically how people respond as bystanders. And roughly an equal number of people, first of all, half of the people said they encourage that person to report it. And within the other half, an equal number of people said they either confront the person or they inform someone within the management. Some interesting responses were someone said they ignore it, and another person said it depends upon their grade and role compared to the other person. So, and their gender. So it does reflect a certain fear or a bias, an unconscious bias, where people will generally weigh if it is safe for them to basically confront the person who's being incivil or not. And it does reflect in a certain way of the 4D strategy as a bystander. The next question was, what do you think are the factors that contribute to it? So this is really interesting. We let the responders choose multiple options, and majority of the responders chose a few options that I think are extremely relevant. A majority chose workload, a majority chose job role and position, so where you stand. A majority chose race, ethnicity, religion, and majority did choose gender. So 50% of the people chose gender. Interestingly, more than 50% of the people chose being new to a trust or department or being unfamiliar with a setting as a contributor to incivility. And within our last few, the workshop held by the patient safety team, this was pointed out by staff from theatre and from the labor ward, that when they meet someone new or someone has just joined the trust, but that just because they don't know that person and they're not familiar, they're not comfortable working with that person, that does lead to an unconscious bias or higher incidence of incivility due to that situation. Now, some interesting responses were one in particular is one person said that basically when people get away with incivility and if it turns into a workplace culture, then it gets even more difficult to get on top of. And it basically shows us a vicious cycle that if we don't deal with it timely and it turns into a habit, then it will increase with time. Another important factor was personal stresses or stressful situations. So if someone is bringing stress from home, it will increase the risk of incivility within their workplace environment. The next question was, how much do you think it affects you in terms of reducing your efficiency and performance within your workplace? So an equal number of respondents said, roughly 40% said it affects it by 0 to 25%. And an equal number said it affects it by 25 to 50%. But having 40% of people say it affects their performance by 25 to 50% within a healthcare setting is a very serious situation. Another 12% it says it affects it by more than 75% of people of their performance. The next question was, how does it affect their well-being and mental health? And more than 80% said it impacts it for hours to days. We unfortunately did not give an option of it not affecting at all, but I think it would be very unlikely for someone facing incivility or similar incidents to not be impacted at all. So 80% said, which is a good thing in a way because the others are affected for longer. 80% were affected for hours to days. Roughly 16% were impacted for weeks to months, and a minority, 4%, for years to lifelong impact. Sorry, I can't hear you, Amita. Do you want to ask a question?
Uh, no, 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 no.
So, all right, okay. Kindly please mute yourself. So the next question we asked was, how does it reduce their positive attitude towards their work? How do they feel in the morning when they're going to work? So 44% said it's affected by 0 to 25%, but roughly 60% said it impacts it by more than 50%, by more than 25 to 50%, or more than 50%. So it does reflect the difficulty in staff retention. The next question was, how does it impact their attitude towards their department or trust? So it is quite similar to what we asked them before. And 44% said they want to be away from work for a few days to a few weeks. It can impact how we retain staff or sickness due to mental health or mental well-being. 20% said they want to change their department or trust, and 4% said they want to leave the profession entirely. There were some other responses as well. 1% said they feel tired, and 1% showed their unhappiness by saying they think that the department does not support them, and this does lead to a hindrance with employing staff and with retaining staff. Now, we asked people what they think, how can we reduce incivility at work? And we asked them to choose multiple options. And almost an equal number have roughly chosen. Basically, they've all said having workshops on incivility, having visual reminders or posters within the workplace setting, having staff members appointed or elected to deal with such situations within different settings and within different departments. It will help to reduce it. And there were a few other options. One person said reducing workload or stress and challenging the people who have been uncivil will help. And another person said that it is really important to address it timely, because if you delay more than delay the response by more than a certain time, then you will not get the appropriate effect or appropriate response. It will affect your communication. It will affect good teamwork. One person said you can't change people's attitudes and you need to basically address the root causes. So I hope we can, moving on from this, we can deal with the root causes and change the incidents. Now, coming to the last slide of this survey, just a brief summary. So basically, we found that more than 80% had experienced it within the last 1 or 2 years. Unfortunately, 1/3 of the recipients chose to ignore it. The factors, again, workload, job role, position, gender, race, ethnicity, and being new or unfamiliar to a trust highly contributed to people facing incivility. There was a significant reduction in the efficiency of the recipient within their department, and more than 80% had their well-being and mental health affected for days to hours, leading to alarming levels of reduction in positive attitude towards their workplace, towards their department, and their trust. So for now, this is it from my side, and I will be handing over to Dr. Walker, and she will now start to present her data. Thank you, Dr. Walker.
Thank you so much, Tuba. And I think what really comes out of that for me is the kind of personal stories that are behind that, and a lot of that information that you got from our survey, your survey within theatres, supports the research that you presented beforehand. But the personal stories and the fact that this is clearly happening within our hospital, within our departments, is really powerful. And I appreciate a little bit of time to talk today as well. We've done some work around civility and incivility, both within some of the education we deliver as part of the human factors workshops that run within the trust, and within we have done some tea trolley teaching within theatres, which is a kind of short ad hoc 10-minute session, usually associated with cake with a bit of bribery to get people kind of involved and engaged around incivility as well. What I thought I would do, and I think I've got control of the slides, can I see if I can move it forward? Yes, there we go. So I thought I'd also just explore the wider picture of the data a little bit more, both nationally and within the trust. And the data that Tuba really eloquently described comes from the theatre environment. But the GMC National Training Survey looks at kind of the experiences of doctors in training and trainers as well. And I'm sure this sort of experience is reflected not just within the medical profession, I'm sure it's experienced within all the kind of our colleagues that work within healthcare. Tuba kind of reflected in her survey that quite a lot of the recipients, quite a lot of the respondents, sorry, about 50% of them were consultants and relatively senior staff. And I think the striking bit from this data here, that is from the 2024 National Training Survey data, is that the more junior you are within the organisation, the more likely you are to expect experience incivility, kind of microaggressions, those kind of negative comments, and kind of it says oppressive body language from colleagues. So the information that Tuba presents is really striking, and I suspect what this information suggests is that it's probably even worse than that, because we're not fully capturing our slightly more junior colleagues within the organisation. This data here also comes from the National Training Survey, and looks a bit more at the kind of, as Tuba mentioned, the slightly more serious side of things. So there is some bits around insults and jokes and microaggressions, but also it focuses a little bit more on protected characteristics, and kind of potentially progressing onto the kind of bullying side of things, and all of which is serious. And this information suggests that it's these slightly more serious behaviours are less frequent than we experience incivility, so the more kind of low level kind of eye rolling, tutting, kind of not quite responding to people, the social isolation side of things that Tuba described. But nonetheless, these behaviours equally are unprofessional and have a really detrimental effect on the workplace. And some of the kind of initial steps towards these may be that you can use some of the techniques in the same way. Oh, don't know what. So apologies, I don't quite know what's happening there. I'm gonna skip forward again. I feel like a gremlin's got into the computer. If it doesn't work too, but I might get you to be in charge of moving it forward. Perfect, lovely. I think it's important to note that we work within a really caring profession, and very few of us come to work to be in civil. And some of the stories and the kind of personal experiences from people kind of that admit that they have had experience of being in civil, and I suspect if we all stop and think about kind of our behaviours, we've all done this at times, is that something happens. Kind of we feel pressure. We feel pressure potentially from our work environment. We feel pressure from our kind of personal lives. We feel that kind of the balls that we're juggling, all those things that we're thinking about, just becomes too much, and something inside us snaps, and then we say something or do something that potentially we would look back and regret. And this is quite. I found this really striking information that Becky Hillary from the patient safety team has developed, and this is correlation between radars. So you can't say it's necessarily causation, but it's this quite striking correlation between radars that look at inadequate staffing and look at suboptimal care and look at violence and aggression and incivility, and all these things are directly correlated, which suggests that as the pressure within the organisation and pressure within your work environment increases, people are more likely to be in civil. There's also some really interesting information out there that says actually the more empathetic we are, the more likely we are to be affected by incivility. So that reduction in our paying attention to kind of what's going on in our work environment, our effectiveness potentially is even greater if we are naturally an empathetic person. And I suspect most people that go into healthcare because we care, and therefore we are more empathetic. And whilst this data and all the data we've demonstrated is from clinical experiences, a lot of the stories that we hear coming from human factors workshops also talk about non-clinical facing roles, and we need to remember that kind of all staff can experience pressure at work and be at risk of demonstrating incivility and not maybe being as civil as they can do because of that pressure. So just to move forward, this is if someone wants some evidence, a bit more evidence behind this, this is a study, a literature review of previous studies done by the University of Surrey, and they're looking at different ways of addressing unprofessional behaviours, and the kind of the bit that kind of really from this really echoes some of what Tuba was saying about, and some of the kind of information that came through in the narrative comments about why people are uncivil, and it talks lots about looking at the pressure within the workplace, looking at the workplace culture, and looking at the kind of responses to incivility, and if we kind of members of staff that feel more disempowered, workplaces that don't have effective processes and cultures to manage incivility, where members of staff feel like they've got less of an ability to speak up, and there's maybe not that same social cohesion within the departments, have this kind of effect of staff are more likely to become uncivil and engage in unprofessional behaviours. They're less likely to kind of challenge or address it, and on a personal level are more likely to be affected by it. And all in all, that kind of results in this reduction of team, I guess, psychological safety and effectiveness. So this all goes on to say it's really important, and it's something that we need to bear in mind and do something about. And it's not on a personal level, it's not easy to do something about, because we feel threatened. If we experience incivility, we feel threatened by it, and we have a kind of natural kind of response that is often part of the kind of fight and flight response that is triggered when we are threatened, kind of going back to kind of caveman days. David Rock is a neuropsychologist that produced this SCARF model. I don't know if anyone's heard of this before, but essentially it says that if anything threatens any of these 5 areas, so these domains of social experience, your brain kind of lights up, and neuropsychologically it recognizes this as a threat. And so things like status, things like certainty, so the kind of predictability and the kind of truth and the things that you hold kind of true, your autonomy, how related, so kind of how much you belong to and are accepted by a team. It kind of reflects a little bit to what Tuba was saying about new employees within an organisation or a team feel like they experience incivility more, and fairness. And I don't know if anyone that can stop and think about a time when they maybe have been a bit incivil. It's often, certainly in my experience, it's often because one of these areas have been threatened, and that's on top of kind of pressure and kind of lots of things on my plate. That threat to my kind of SCARF model then triggers me into kind of having the kind of same almost physiological response to the kind of fight, flight, and freeze. And we all know about fight and flight quite well. We suspect, if we stop and think about it, we recognize freeze as well, and that's that bit about you dwell on something a bit later on, that kind of, oh, why didn't I say this, or I should have said that in response. And you can see how that can then impact on your clinical effectiveness or your kind of workplace effectiveness for a prolonged period of time, because you're kind of casting your mind back to that event. Oh, I should have said that, I should have done something else. Fawn, I think we talk about less often. So fawn, in response to a threat, turns people into this kind of people-pleasing type attitude of trying to prevent future events and trying to kind of avoid situations that could lead to conflict. Maybe going along with the kind of expectations of the person that was incivil to you, even if though that is detrimental to your own kind of aims and objectives and expectations. So it's interesting that I think it's interesting that there's definitely a personal element to both being incivil, to how we react to when someone is incivil to us, but also there's this kind of wider workplace element to it as well. And Tuba talked about the 4Ds and about how we and our workplace should do something about incivility. And if we don't, that kind of toxic environment of whereby we accept incivility can become more of a norm. But it is really difficult to do. And there's lots of reasons, to be fair, why it's difficult to manage incivility and manage microaggressions. And there's some quite good kind of evidence and explanation behind it that I think is useful to understand, because then I think that helps us kind of deal with things moving forward. And some of this is known as the bystander effect. One quite good example of that is this idea of the diffusion of responsibility. So there's more people that witness incivility, the less likely any individual is going to do anything about it. You can relate that maybe to if you're sat in an office with someone or kind of walking down the street and there's one other person with you and they collapse. You're going to run over and you're going to check they're okay and do something about it. However, if you're in a hall with a couple of hundred people and someone collapses, chances are you'll have a good look around first of all to see if anyone else is going to do something first, and not that many people in that situation will run forward to help. And the more people there are, the more that responsibility of reacting is diffused and no one feels that it's down to them as an individual to do anything about it. Other reasons why it's difficult to kind of manage and kind of tackle, I suppose, incivility is things like social influence, especially if you're new to a team, as Tuba mentioned. And we have this kind of innate social desire to conform to a team that we're working within, and we kind of follow the actions of others as a path of less resistance. So when no one else does anything, it's kind of easier to not necessarily do anything yourself, and that can allow behaviours to become kind of normalised. Other things include ambiguity even, and if it's not really clear whether someone meant to be incivil or were incivil, and to be fair, a lot of times people don't mean to be incivil by their behaviours, and a lot of people just get given the benefit of the doubt, then you're less likely to kind of to react and do something about it. Perceived cost is important. If someone is, I don't know, going to sign off your annual leave form, or going to be reviewing your appraisal, or thinking about whether you get a promotion, again, you're less likely to challenge them if their behaviour isn't quite appropriate. And a bit of it, I think, comes down to that we're afraid to look foolish ourselves, or be afraid of being judged by others, which makes us less likely to kind of take action. So Tubers mentioned this idea of the 4Ds, and this is a model essentially that allows us to become an active bystander, makes us more likely to overcome all those challenges that we talked about around kind of seeing when we see behaviour that maybe isn't appropriate. And sometimes it's kind of important, it's helpful, I guess, to think about these models and kind of rehearse a little bit what you might say in any situation. And what you do very much depends on that situation, and the 4D model gives you a bit of an option about different things you could do. And I think it's important at that point you have a little, if you do witness some incivility, have a little check-in with yourself, see how you feel about it, see what the situation is, and does it feel safe, both from a kind of personal and a kind of professional perspective. So there's 4 things, there's the 4Ds, and I'll spend just a tiny bit longer just talking through some of those in a little bit more detail. So the first one is declare or direct, depending on which version of the model you look at. So that's kind of saying something there and then in the situation. So first thing you could do is ask the receiver if they're all right. There's simple things you can say. Sometimes feigning a little bit of ignorance is kind of helpful. Oh, I'm sorry, I don't know, did you mean to say that? Oh, I don't think I quite heard what you said. Or you could be a little bit more direct about it, but being kind of understanding at the same time, and remembering that fact that the majority of people, vast majority of people, don't come to work to be incivil, and a lot of people don't even recognise that they're being incivil. So, I'm not sure you realise that you're raising your voice, or I'm not sure you realise that you're coming across as being stressed. It's making us uncomfortable. What can we do to help? So don't ignore it, but kind of be supportive in declaring and kind of suggesting some direct action. If that's not something that you feel is comfortable to do or is appropriate to do, then distracting is another way forward. And there's lots of ways you can distract. You can ask an incivil colleague a question. You can tell the receiver of the incivility that they're needed to do something else, or could they take a phone call? Sorry, or can I have a word with you about something? There's lots of ways of refocusing the kind of attention of the team on the task in hand. You could simply say, should we just concentrate on what's going on with this in this situation now? And we can talk about this later. And distracting doesn't mean ignoring things. It just allows us that opportunity to concentrate on the situation that is the priority at that point, and then we can move on to either delay and having a conversation thereafter, or delegating and asking someone else to have a conversation. And when you delay, again, I think there's that opportunity to have a supportive conversation, both with the person that was a receiver of incivility, but with the person who was the instigator, which sounds like a bit of a kind of strong word, but was incivil. And you can check in with the receiver, ask them what they would like to happen next, offer to speak to the person if you feel comfortable doing that. And there's quite a nice technique called a cup of coffee conversation that allows you to have a really kind of supportive, non-confrontational discussion with someone about, and just basically share what you experienced, what you saw, in a curious way, without kind of making judgments about what happened and about the rationale behind it. And we'll mention that in just a moment. I guess the final option there is delaying. And if you or the person receiving the incivility, or the team, don't feel able to speak up, then it's perfectly reasonable to delegate that to either a senior colleague, or we have Janice joining us later as our freedom to speak up guardian. And there are several routes within the trust whereby that can be delayed and delegated to. So just a couple more slides from me before we talk about that. So I don't know if anyone's seen, there's an NHS Civility toolkit, which has got a great kind of set of resources in about how to kind of manage incivility within NHS organisations. And a lot of it's focused around the approach that was developed by the Vanderbilt University. And what they said is that actually most of these kind of episodes of incivil kind of behaviour come because people are under stress, and because, as we talked about, their back's pushed up against the wall and something snaps. And actually, in most situations, we just need a bit of time to allow people to reflect, and a bit of support. And as we talk about in the human factors workshops, a bit of kindness, to be fair. But there is a graded approach whereby that isn't enough, and they talk about a level 0, so this cup of coffee intervention, a level 1, so a kind of, if there's a bit of an apparent pattern of someone kind of fairly consistently being incivil, so they can put an awareness intervention, usually by a kind of lead or a line manager, and then level 2 and 3 approaches that tend to involve kind of human resources and kind of slightly more formal kind of disciplinary pathways. The majority of stuff is managed. The majority of stuff is managed by that cup of coffee conversation. And by that we mean it's just taking a moment to have a private chat with your colleague that was incivil, and often saying things like, well, can I just have a moment to chat to you? I'd like to just share something I saw, or share an observation, and check in with them, make sure they're okay, make sure that there's nothing that's on their plate, and then you can use language that kind of isn't confrontational. So I may be wrong, but I think I heard, or I think I saw you say this being said, avoiding the words like you, or you did this because, and I saw this, and it can be, that's a bit more confrontation. So it's just that gentle language, describing the situation, describing what you saw, so the behaviour, and then often describing it, impact is quite helpful. So the staff involved told me that they felt really really stressed and weren't able to concentrate, and weren't able to kind of offer kind of effective patient care. And I really value you, so I thought you wouldn't to know this. And usually that will get you a response where most people stop and will reflect and have a think, and kind of, often people are quite shocked and take some time to kind of figure out why it was that they acted in that way. Often will apologise, and kind of think about their behaviour moving forward. So that's what I wanted to add in there. I wanted to talk about a bit more the global picture, to emphasise some of the kind of really kind of human stories I think Tuba's told through her data that supports what's going on nationally and in most organisations, but also kind of makes it quite clear that it's a problem in Milton Keynes, and then kind of come up with some strategies that we can use in a kind of curious and supportive way, to help manage the low level incivility that we sometimes see within our kind of stressed departments. I'm going to hand over now to back to Tuba, just to talk about, because she's had some reflections around other recommendations that has come from her work. So I'll let her talk about that, and then let Tuba hand over to Janice to talk about freedom to speak up.
Thank you, Dr. Walker. That was a lovely information about how to deal with incivility. I think if we apply that, that will really help us. So it's quite, our recommendations, what me and Dr. Diwan came up with is, I think, quite similar to what you've already told us. Just a few recommendations. Firstly, we feel like, although we know Janice is a Freedom to Speak Up guardian, she's doing lovely work, but she's just one person. And we think that having speak up champions or peer messengers locally within the different departments, where the staff members are familiar with their faces at least, having some sort of a vote or election for such a person in each department, a person who's known to everyone as easily approachable and someone who can help in these situations. We think that will really help. Secondly, mandatory training might include incivility as well. Maybe some simulation or video training where you show in real time such incidents, so people can actually feel and learn how to acutely deal with such situations. That might help. Um, I think we've already got thank you letters going on within the labor ward and the obstetric side of things. Maybe we need to expand that to the whole trust. We've also already got the option of Greatix, although we think it might take some time to fill it, and that might discourage some people from filling it. But having more of the appreciation thank you letters or the Greatix might help reduce this for when people stand up to it or when people actively deal with these situations. Again, peer messengers, as we said, like when people talk about such incidents afterwards, or like with just having informal conversations, those peer messengers can be really helpful to help avoid escalation. Friendly induction process, when we talk about people being unfamiliar, being new to a department or a trust, having a friendly induction process, and by that just having a preliminary conversation or a meeting with the contact person, with the CSU lead or the people in management, something just to make the induction process more human, more friendly, and might help. We've already got a patient safety working group, and they're running these amazing workshops on working together effectively. I did attend one of those where we had staff members from theatres and members from labor ward who basically sat down together, and it was more of an informal conversation, and they really talked about the situations that bother them, why they think it happens, what they think might help. And I think that was really useful in pointing out the factors. And I think they did agree in the end that maybe shadowing each other, really having a look at the pressures that the other party faces might really help. So I think having more of those workshops and more of the shadowing might really help with that. So these were some of our recommendations, and that's it from my side. And I will hand over to Janice. She's our Freedom to Speak Up guardian, and she will continue from here on. Thank you.
Thank you. I'm really sorry my camera's not working, so I can't put it on. Are you all right, Tuba, to move the slide on? I can take control. Or
so I've currently given control to Dr. Walker. Dr. Walker, are you happy to
it's
control the
just two
slides?
slides.
Yes.
I think I've given it you back to, but sorry.
Let
Oh,
me see
sorry.
if I
All
can
right.
take
Okay.
control.
Okay. All right. I'm going to give you control, Janice.
Okay, lovely. This is how it works in real practice. Oh, aha, there we go. Oh, we've moved on one too many. There we go. So thank you all for including me in this presentation. And actually, it's really welcoming to hear us talking openly about incivility, which I think can sometimes be quite a taboo subject. But I think we've seen from the slides the majority of respondents have encountered or witnessed this, which is actually really disheartening, and the impact it can have on individuals and on our patients actually is immense, and we know it could well be avoided. Honestly, nobody should be coming to work and having to experience any form of negativity, especially from our work colleagues. So I was briefly asked to cover incivility from the perspective of staff approaching freedom to speak up for support with negative behaviours and attitudes, and from a national perspective, and then from a Milton Keynes perspective. I will say that having heard the outcome of the survey, 25 respondents, this scarily low. And I think it's great that we've got that information, but what it also does say is quite a lot about how confident staff feel in completing surveys, but also do they feel confident if anything's going to happen as a result of it. So firstly, it's important to note that Freedom to Speak Up is not the only team, as you've seen earlier on, where concerns like this are reported. There'll be HR data, obviously the radar information, and reports to your unions, which will provide a more accurate picture. It's also important to note that the majority of staff, as shown from the respondents, won't feel confident to report incivility, mainly because they fear they'll suffer repercussions if they do. So I would say that if we look at these numbers of the concerns raised, they're really a fraction of what's really happening in practice. So let's just be mindful of that. I always bring the fun part to it. So every NHS trust must have at least one Freedom to Speak Up guardian, and they can be in any guise. They can be protected time, a secondment or a permanent post. Nationally in 2024, there are over 1,200 guardians. So I'm guessing that figure's probably doubled because there's been different guidance come out in the last year. Of the number of cases raised nationally, 35% was around incivility, either inappropriate behaviours and attitudes, and approximately 20% for bullying and harassment, which is actually quite high, bearing in mind Freedom to Speak Up was set up to look at patient safety complaints. At Milton Keynes Hospital, we have 3 guardians, 1 full-time and 2 with protected time, and we also have 9 champions. I'm going to put a call out if anybody's interested, and I'm sure we can work around if we want to do a nomination scheme, but I think it's better if people apply to be a Freedom to Speak Up champion if they have that desire and want to do it. So more than happy to support that. So we have 9 champions, and last year there were 94 Freedom to Speak Up cases raised, 27% with inappropriate behaviours and attitudes, and 23% with bullying and harassment. This financial year, it's slightly different. We've seen a bit of a change. We've had just over 40% of our concerns in total, which have been raised, which have an element of incivility or negative behaviours. And they include things, and this is what's happening in Milton Keynes, like staff being shouted at or sworn at, completely ignored, ostracised by their teams, ignored by their managers, treated unfavourably with processes and policies, and the looks, definitely the looks and the lack of inclusion. So I think it's really difficult to ask and expect staff to challenge or call out incivility in the moment. It's quite difficult. It depends on where it is, who's around, as has been spoken about earlier, and many other variables. So I wouldn't recommend that staff intervene in every situation. It's almost like you have to mentally assess the risk beforehand. Are you safe to do so? Do you feel safe enough? And that means both physically, verbally, emotionally, and psychologically. And a lot of what we talked about earlier on is around feeling psychologically safe. And that's the real preventer of people intervening, because actually, what's going to happen to me if I do? Am I going to get shouted at in response? Will someone demean me even further in front of my patient or colleagues or junior staff or even your seniors? Will you be completely ignored? Will the issue be brushed under the carpet? Because we hear that an awful lot and we experience that an awful lot. So the next time you ask, will you get your annual leave signed off, or the bank shift you're desperately relying on, or will it affect your chances of promotion? Will you become known as the troublesome one? Because all of those reasons and many others are the reasons why staff don't feel safe to professionally challenge incivility in the moment. So what do you do? There are various routes in which you can speak up or share your concerns, including, and we always advocate this, your line manager or other manager within your team. But we know that it's not always productive or conducive for various reasons, or you may not feel comfortable to do it. It may be your manager that actually is the one that's been incivil to you. So we have Freedom to Speak Up Guardians as an additional route. You can find information on how to speak up or raise a concern on the intranet under the header support. Bear with me, sorry, I forgot to change that. Oops, I've lost control. Have I lost? There we go. There we go. Yeah, so there are, we have the information on the intranet, and it shows who you can speak up to, and there's reporting processes, and it's all within that. There's definitely some confidence building and faith building that we need to do in our organisation so that we as staff members trust the reporting process and the people who conduct such investigations. And that's going to take time to build as we build new processes and develop new processes in the trust to help change that culture around reporting. And I think sometimes we need to be able to be honest and reflect on ourselves, who we are, how we come across, what messages do we give out in the moment? Because as was said earlier, we all come to work to do our job and to do a good job, but we all have bad days. And it may be that we're in work overload and haven't got a second to spare. And it may be a situation or encounter which happens on that bad day, which results in us either not getting involved in the situation or we may unintentionally offend or be rude to someone. Because let's be honest, we've all done this at some point. I think the key part is what do we do after? Are we able to be honest and recognise that we may have hurt somebody's feelings? Do we try and apologise to them after? Because of course most incivility is not intentional and it can be addressed informally as Dr. Caroline explained earlier. And that can be done just after the moment. And there'll be instances where it is intentional, it is harmful, and it is abusive. And these are the instances that we should feel more comfortable to report more formally. So please do look at the intranet to find out how you can do this. I agree with all the recommendations. And again, I throw it out there. Absolutely. We're happy to have more champions. And those are the practical steps a trust can make to promote a professional and supportive workplace. And I guess my only addition to this would be to recommend that if you're in a situation where inappropriate or negative words or actions are being displayed to you or another member of staff, think about what would you do if that person were your son, your daughter, your niece, your nephew, your mother, your auntie, your grandfather, friend. Yeah, I think you get the gist. Would you stand by and watch a loved one being abused? Probably not. And I'd hope that you'd either confront the person courteously, because honestly, there's nothing more humiliating than addressing ignorance with kindness, or you'd report it in the hope that something constructive's done. So I hope this helps. It's a little touch. You can always get in touch with the Guardians if you want to discuss something, but actually what we want to do is try and make sure that managers are dealing with the issues when they come to them. So thank you very much. I think I'm handing back to Tuba now. Oh, maybe not.
Tuba, are you there? I guess Tuba, pop a camera on. I guess we've got 2 minutes left, haven't we? I think of the plenary session. So if anyone has any questions or has any comments, we'd be very receptive to them.
Is it always this quiet?
Don't know, but otherwise we will we'll let everyone get on with their days. But if you do have any questions or comments, oh, Jill's put your hand up. Brilliant, Jill, you saved us. Thank you.
I thought it'd be brave. I've written it in the chat, but I haven't sent it, so I'll just ask it instead.
Really, thank you, Jill.
Really interesting work. Actually, I'd be really keen to do something similar in my own area. I just cheekily wondered if you'd be willing to share the surveys rather than reinventing the wheel.
Yeah, I think we can do that. I can send them to you, Jill.
Be interesting to see how the response in a different area compares, and
yes,
to what's out there. Thank you.
Thank you. And Hamid has also popped his hand up. Brilliant. Thanks, Hamid.
Yeah, that's okay. I just put my head up to say thank you so much. I think it's been really interesting, very helpful. I think it's really important that we know where to go to when we have these difficulties in the work environment. We should also realize that we're not alone when we have these difficulties in the work environment, and we shouldn't feel isolated when we're having these problems. If these problems indeed are occurring, we should be able to go and speak to people and know it's not acceptable and know how to escalate. So you've touched on all of those points. I think I would just say to people in this audience, if you have more questions offline, then Caroline, Tuba, Janice, you are very good people for us to come and speak to it and get more advice from. So thank you very much for today.
Thank you, Hamid.
Thank you.
Much appreciated. There's some questions in the chat. And this one might be one for you, Janice. So Brett Kintu has asked, what protections are there for, I guess, consultants or any member of staff in these situations? Because it can be quite difficult for them to get support.
So it's really difficult. Depends on what they're raising. If it's something in the public interest, then there is the whistleblower protection, the protected disclosure. But in terms of the organisation, 99% of the concerns that come through for myself and probably for others as well, they're not necessarily in the public interest. And it's what protection can we give to staff? And I'm going to be really honest here, as you know, I always am. We're not there with you when you're working on in your ward or in your department. So actually, when you raise something, we will talk through what happens next. We can't guarantee your protection, and that I will probably be told off by saying that, but that's the reality. We cannot protect you. We can support you. If there's something that happens as a result of it, you can come back and then we'll then take that through investigation. But actually, who would want to, if you've spoken up about something already and it's going through a process or some form of process, it's highly unlikely that if something happened as a result of it, somebody would want to come back to us and tell us, although we rely on people doing that because that's when we can take it further. So sorry, not a great answer, but it's the honest answer.
No, and I think that is an honest answer, and that's really helpful, Janice. Thank you. I might just finish by saying thank you to Tuba, because this is all your hard work that has kind of really generated this conversation, and I think has led to a really excellent plenary session. So thank you to you and to Preeti for kind of all your work about kind of and getting us those kind of, I guess, staff comments and staff kind of stories that are so powerful, and hopefully we'll kind of continue with the conversation and the kind of actions around that. And thank you to Janice. I think that's a really insightful kind of and useful kind of input about the Freedom Speak Up Guardians, and I've certainly learned a lot more about that as well. If anyone's, unless anyone's got any other questions, shall we draw things to a close? What do you think?
Yeah, thank you, Dr. Walker and Janice. Your contributions have really made it much better. We want to go forward with it, and we want to do either a follow-up or add a few more questions to this so that we can see if we've implemented some strategies to deal with it, and then do another follow-up survey to see how things have changed. And hopefully we can do that soon.
Look forward to it, Tuba. Thank you. I hope everyone has a lovely rest of the afternoon.
Sir, what weather is this, sir? I know. It's absolutely ridiculous. We need to go to India and ride it. Honestly.